Alright, in this tutorial we're going to cover a topic that is related to anatomy, physiology, and also pathophysiology, and talk about capillary fluid dynamics, and just emphasize on the importance of how fluids are exchanged. Cannot say that fast. How fluids are exchanged between our blood and our tissues for the purpose of delivering nutrients and oxygen and reabsorbing waste products back into the bloodstream, and some applications of that when that process goes wrong. And so basically the topics we're going to cover, we're just going to kind of give a brief overview of, or we'll have a brief discussion about the cardiovascular system and how it relates to this particular subject. And we'll have a brief review of capillary structure and the types of capillaries in the body. And then we'll spend a good amount of time talking about the forces involved that drive this process to occur. And then we'll talk just a little bit about the lymphatic system and the role that it plays here, and then some clinical complications of when this process goes wrong. All right. So let's just kind of refresh our memory about the cardiovascular system here. Remember, the purpose of the cardiovascular system is to circulate blood throughout the body for the purpose of delivering materials all over the place. Most of the time when you think about the delivery of something, you think about the cardiovascular system as delivering oxygen to tissue so they can, burn it up and use it for metabolic purposes. But the cardiovascular system is also delivering waste products to appropriate areas for us to process them and eliminate them as well, such as the liver, where we process old hormones and drugs that are taken, and then, or alcohol and so on, and then the kidneys filter the blood and remove waste products and excessive electrolytes and water and so on from the bloodstream, and we eliminate it as a waste product via urine. All right. Now, in order for our cardiovascular system to work effectively and efficiently, we have to create a large surface area so we can maximize our ability to deliver fluids and nutrients and waste products to the appropriate areas of the body. And the only way to do this is to start big and work our way to smaller. Now, what I mean by that is, that the heart is the pump that creates the pressure, that creates the forces, the major forces that drive blood flow throughout the body. And as we pump this well-oxygenated blood out of the heart, all right, we do so through one major vessel, and you know that vessel as the aorta. All right, and then from there, the aorta is going to branch, all right. The aorta is going to form branches that start to circulate blood, to other areas of the body. So basically, what I'm saying here is that we start out with one major artery, the aorta, and then we start to create these smaller distributing arteries, these offshoots of the aorta itself, and then there are offshoots of these distributing arteries. And every time we have an offshoot, these arteries keep getting smaller and smaller in size. All right, so we go from about one aorta. Okay, we go from about one aorta, and if we count up all of the major kind of these branching out distributing arteries of the body, we get right around 2,400. All right, 2,440. All right, I'm just going to abbreviate this D for distributing arteries. Okay. So these arteries are branching out, and they're covering more surface area, and then they're going to branch out even more. So when I say these distributing arteries, I'm talking about just distributing arteries in general, and then also these types of arteries called arterioles. Okay, arterioles, and then they branch, into, I'm just going to abbreviate this, meta-arterioles. Okay. And then basically once these arteries branch out to the point to where we form meta-arterioles, then we form capillaries. And there are about, on average, 1,200,000,000 capillaries throughout, inside of the average human body. Now, again, these are this is just an average number. All right. Now you're probably thinking to yourself, well, why am I talking about this? Why is this? What's this joker sitting here talking about the size of these vessels for and the amount and so on? You have to remember that we are composed of, billions upon billions, trillions of these little functional units of life we, refer to as cells. All right, and cells are very metabolically demanding. And in order for our cardiovascular system to reach out to all of these cells and appropriately supply them with fluid and nutrients and to eliminate waste, the best way to do this is to basically match these cells in size. All right, so these large vessels, branch out and distribute into smaller vessels, and by doing this, by forming these very small single-layered capillaries, these microscopically sized capillaries that are on average about 7 to 8 micrometers, about a hair bigger than a red blood cell. This gives us a very individualized form of delivery of fluid and nutrients and oxygen to the cells. All right, so this allows us. So by getting microscopic and smaller in size, this allows us to maximize our ability to deliver. Now, if you have already seen the video I made about the kidneys and renal blood flow, you're going to see a pattern and a theme here. You see this in the lungs as well, where we really need to maximize our ability to circulate blood over a very large surface area, but yet maximize our ability to exchange gases and nutrients in those particular tissues. The best way to do that is to create, to disperse our vessels out, billions of them, in microscopic in size, like I said, so we can create an individualized delivery system for the cells. All right, that's the best way we can maximize our delivery. All right, and then what's going to happen are these, basically you're going to see some convergence. You're going to see about these capillaries are eventually going to form into about 80,000. 80 million vessels called venules, which are basically the ends of capillary beds. And then we'll kind of notice we're kind of seeing a pattern here. 2,400 veins, and then we have one vena cava that has two major branches, a superior and inferior vena cava. And then this process starts all over again. All right, so basically by creating this system of distribution, we maximize our ability to deliver fluid and nutrients, and we maximize our ability to absorb waste products out of the tissues and circulate them around as well. All right, so now obviously the vessel we want to focus on the most in this presentation are capillaries. All right, we want to focus on capillaries because you have to remember the cardiovascular system is a closed system. And remember what that means is that basically the blood within the cardiovascular system is meant to remain within the cardiovascular system. All right, capillaries are a little weird because these are porous vessels. All right, these are vessels that have pores. All right, and I'll talk about that more in a second. But one thing you have to understand about capillaries is that so you're pumping this gelatinous / liquidy kind of a blood through the vessels. That was technically put. You know that if you pump something that is a liquid through a tube that has holes in it, some of it's going to leak out. All right, so you're probably sitting here thinking to yourself, well, how is this a closed system then? If we are leaking fluids out of the bloodstream, through capillaries into tissues. Well, you have to remember, whatever leaks out gets reabsorbed back in. All right, and then that is what we call the fluid cycle, and we need to make sure that we maintain a steady balance in this fluid cycle so we don't have complications like edema and so on. All right, so let's kind of talk about these capillaries a little bit. There are three major categories of capillaries that you find in the human body. The ones that we're going to be focusing on in this video are going to be the continuous capillaries. All right, these are the most common and the most abundant capillaries in the body. These are the capillaries that you think about when you're talking about forming capillary beds in tissues. All right, so when we're talking about forming capillary beds in tissues, like your muscle tissues, your skeletal muscle tissue inside, the tissue in your intestines, the capillaries in, in your brain, capillaries in most tissues of the body, in your lungs. All right, these are, continuous capillaries. So these are going to be the main focus of today, so we'll come back to these. I'm not going to spend a lot of time on these because I already have a video created called Renal Blood Flow where I focus on fenestrated capillaries. These are predominantly located in the kidneys. All right. Now these are a specialized type of capillary because now what this is right here, you have to remember capillaries are very simple in design. They're basically simple squamous epithelial tissue. I'm going to abbreviate epithelial because I'm too lazy to write the whole word out. Simple squamous epithelial tissue. And remember, when we are talking about simple squamous epithelial tissue, you're talking about one layer of flat, boring squamous cells. All right, one layer. And like any other form of epithelial tissue, there's going to be a basement membrane. All right, a thin gelatinous basement membrane. Now, when we talk about pores in capillaries, like for example, if you see these black lines right here, these would basically be the pores or the channels in between the cells. So remember when you learn about epithelial tissue, you learn about epithelial cells and epithelial tissue of being comprised of cells that are really tightly packed together. All right, and that's what makes epithelial tissue this great covering and lining tissue. Now with capillaries, this is a little different because, for example, in these continuous capillaries, if we were to look at this from a transverse view here, all right, you would see this. All right, the cells don't, the endothelial cells don't completely touch together, and there are these small spaces in between, and that's where we filter the fluids out of and reabsorb the fluids back in through. All right, with these fenestrated capillaries, these also have these filtration spaces in between the endothelial cells, but the cells themselves are also highly porous. Now this is important because this allows us to create a highly filtered, what we call ultrafiltrate in the kidneys. All right, when we're filtering our blood in the kidneys, we actually overdo it in terms of filtration. We filter out way too much materials out of the blood and into the kidneys, but whatever we don't need to eliminate from the body, we reabsorb back into the bloodstream. All right, and this is a good system when you think about what the kidneys are about, because by overdoing this, we maximize our ability to eliminate those unnecessary products from our blood out of our body, and then we just reabsorb what we want to keep back into our bloodstream. All right, and that's the overgeneralized version of it. But like I said, I have a video that details that a lot more. And then these sinusoid capillaries, these are found in areas like the liver. All right, in red bone marrow. Now so basically what's going on here, again, similar in design to these continuous capillaries and fenestrated capillaries, except they're not porous, like the fenestrated, but similar in design in the fact that, one layer of epithelial cells, except the difference here is that these squamous cells are much farther apart, and that's what creates these big sinus, these big almost cavernous like sinuses. All right, that's why they're called sinusoid capillaries. Now this allows large materials to pass out of these vessels, out of these sinusoid capillaries, and into the appropriate areas. Now, if you think of an organ like the liver and all that it does, for example, when you think about how the liver manufactures plasma proteins like albumin and your fibrinogens, all right, we want to be able to get those proteins into the bloodstream, and we need spaces large enough to squeeze those proteins in. You know that the liver, the common word that people like to use, the liver detoxifies the blood. Well, what we're saying there is that the liver filters out in similar fashion to the kidneys lots of unwanted materials like drugs and other materials. All right, so this allows us to maximize our filtration in the liver, so the liver can clean out the blood. All right, and this would make sense in red bone marrow because this is where we make blood cells. And in order to get blood cells into the bloodstream, we need spaces large enough to get them into the bloodstream through there. All right, so that's about all I'm really going to say about these two types of capillaries in this video. Like I said, the main focus is going to be on continuous capillaries, the more peripheral and common type of capillary in the body. All right, now, you heard me say in the previous slide that capillaries are typically organized into beds. All right, so you typically don't just see one meta-arterial and then just one capillary and then one venule. All right, you typically see a meta-arterial and then you see many capillaries branching out from there. All right, and then these capillaries, like I said, I mean, they form, I mean, basically a bed in these tissue spaces. Now, this branching nature of these capillary beds, again, allows us to maximize our ability to reach out to all of these various cells in this tissue and nourish them with blood. All right, and deliver oxygen and water and other nutrients to them and pick up waste very effectively. Now, a couple of things to keep in mind about this is not all capillary beds in our peripheral tissues are perfused with blood at any given time. Most of the time, about 25 to 30% of all these peripheral continuous capillary beds are actually closed off because there are these sphincters that are called pre-capillary sphincters that basically keep these vessels closed. They keep these meta-arterioles closed off. So then basically what happens, and there's typically one bypass vessel that passes right through here, and then blood goes through here, and we don't really have any delivery going on. All right, now in a situation like exercise, so basically what I'm saying here with this is that this is all we need in order to keep ourselves alive on a day-to-day basis. This is all the delivery we need to do, and that's how effective of a system we have by creating this mass dispersal of these microscopic vessels. Now, in a situation like exercise, where we are adding more stress and demand on our body, where we are increasing the demand for oxygen and glucose and fats and so on to burn for energy and some amino acids in the late stages of exercise, obviously, many of these sphincters are going to open up, and we are going to increase our perfusion rate into more capillary beds, and that's how, one of the ways we can compensate for something like exercise. All right, and then and then another thing you have to understand about this is that by doing that, we also maximize or do the best we can in terms of absorbing that excessive CO2 back into the blood and other, organic acids and metabolic waste from exercise. All right, so that's something you have to keep in mind. Now, another thing that I want to focus on here is, I'm going to erase all that, is notice the cells here. Notice the cells. Notice how all these cells are really close to capillary beds. I'm going to say this right now, and I want you to remember this. Cells are no more than 2 of their own diameters, or you can say widths, away from a capillary. Okay, cells on average are no more than 2 of their own diameters away from a capillary. Now, why is that? Okay, why is that? That's because cells have to be close to capillaries. That's how metabolically demanding the average cell in the body is. All right, the further away cells get from capillaries, the longer it takes for oxygen to diffuse through the tissue spaces and get to these cells, and the longer it's going to take for waste products to get from the cells to the bloodstream. All right, so by having this, and that's a big reason why we have these billions of capillaries, so we can basically close the distance between the bloodstream and pretty much all the cells of the body. So we have a very quick delivery system from blood to cell and cell to blood. All right. Now, the reason why I'm telling you this, because I'm going to want you to remember this little fact when we start talking about edema. All right, and how edema affects this distance here. All right, I'm not going to talk about that right now, but again, keep that in the back of your mind. All right, so now that we've kind of given a basic overview of capillaries and so on, let's start talking about now the forces that are involved in the actual delivery of fluids out of the capillaries into tissues, and then vice versa from the tissues back into the bloodstream. And we need to cover those. Now, before we get into that, there's a lot of key terms. Well, not a lot, but there's a good handful of very important terms that you have to understand. And one of those is interstitial fluid. Okay, interstitial fluid is the classy way of saying tissue fluid. All right, the water that is in the tissues. All right, so basically tissue water, or you could say the water that cells are bathing in. Okay, So this is the water that is inside of the tissues but outside of the cells. Interstitial fluid, this is not the same as intracellular fluid. Okay, remember, intracellular fluid is the actual water inside of the cells. Interstitial fluid is the fluid that is surrounding the cells in the tissue spaces. All right, and it's important that you don't mix those two up or lump them together because they are very different. All right. And again, you're going to hear me use this term a lot, so get used to seeing it, all right? And especially when you're learning about things like water, electrolyte balance, capillary fluid dynamics, edema. I mean, when you're learning about kidneys and water balance. I mean, this is a word that you're going to see left and right. So get to the point to where you can recite this term and its basic definition in your sleep. All right, interstitial fluid is tissue fluid. Now, there are four major forces that are involved in this process of driving fluids out of the bloodstream into tissues and reabsorbing them back into the tissues. All right, and these are what are called, basically, if I have any students out there who are going into, pre-med or upper level physiology, these are what we would call these Starling forces. Okay. The Starling forces. All right. Now, basically, what these are is what we have here. If we look at these forces for what they are, what we're basically looking at is we're looking at two pulling forces and two pushing forces. Okay. We're looking at two pulling and two pushing forces. Now, the biggest pushing force that is involved in this exchange process is what's called capillary hydrostatic pressure, often abbreviated uppercase P and lowercase c. Okay. Capillary hydrostatic pressure. Basically what capillary hydrostatic pressure is, this is the water pressure inside of capillaries. All right. Again, I'm going to say that again. The water pressure inside of capillaries. All right, so let's say you go to your neighbor's house. You go to your neighbor's house and you take a screwdriver over there with you, and you're bored, and you punch holes in your neighbor's garden hose. Again, I'm not promoting this. This is just a hypothetical because you obviously wouldn't want to do this to your own hose. So let's say you pop some holes in the hose. All right, so we've got holes. So we just created an artificial capillary. Sweet. Now let's say you turn the spigot on the nozzle here. You turn it to 1/2 power. All right, so it's not turned up all the way. It's turned up halfway. Now you know that if you have this hose with a bunch of holes in it, the water that's going to come out of these holes is not going to be equal as the water flows throughout the hose. All right, you're going to see more water coming out, all right, of the holes that are closest to the actual spigot itself. All right, and then it's going to get to the point to where as water flows further down the hose to where water is just going to kind of dribble right out of there. And the reason for that is that these holes that are closest to the nozzle and the spigot here is that these holes here are closest to the source of pressure. So as a result, the capillary hydrostatic pressure is going to be stronger the closer you are to the source of the pressure, and that's going to create a stronger driving force and force more fluids out. And then as this water flows through the length of the hose, basically, A, we're getting further away from our source of pressure, and B, the friction of water, rubbing up against the hose as it's passing down will slow it down. And you put those two together, and that's gonna make less water filter out. I mean, some water will come out, but not nearly as much as over here. All right. So think of this end of the hose right here as the arterial end of let's say this is the arterial end of a capillary, and this would be the venous end of a capillary. All right, so keep this little analogy in the back of your mind. So the point I'm trying to make here is that the capillary hydrostatic pressure, the water pressure inside of the capillary, is a major driving force that forces fluids out. All right, that's what that is. All right. And then tissue hydrostatic pressure, all right, is another force that potentially plays a role in the forcing of water in one place or another. But the thing with this though is that tissue hydrostatic pressure, the water pressure in our tissues, is typically very low. Now, depending on what book you read, most basic anatomy books will say that tissue hydrostatic pressure is going to be at about maybe 0 to 1 millimeters of mercury, which is practically nothing. All right, some books will say, tissue hydrostatic pressure is about 5 millimeters of mercury. All right, for the sake of simplicity, I'll just keep the discussion to 0 to 1. But the point here is that tissue hydrostatic pressure is very low. The water pressure in the tissues is very low. And the reason for that is that tissues don't have a driving force, like the heart, moving the fluids around in there. All right. So there's no pump, there's no source of pressure. That water is going to remain relatively stable in there. All right. So this doesn't play under normal conditions, isn't really a huge factor in moving fluids around between the blood and the tissues. All right. Now, so those are your major pushing forces. Now, the pulling forces. Now, notice you see some similarities here. Colloid osmotic, colloid osmotic. A lot of times you're going to see the word oncotic. Okay. Now, basically, these both mean the same thing. All right, this is probably a little more technically close to the truth behind what this force really is. But like I said, the books, kind of switch between both of these terms, so that's why I'm throwing both of them at you. Now, what it boils down to is the force of proteins on water. Okay, the force of proteins on water. Now, proteins are very hydrophilic molecules, meaning that they get along with water, they mix with water, and to the point to where proteins pretty much exert a very strong attractive or pulling force on water. So basically, wherever there's proteins, there's going to be a lot of attraction to or pulling of water. All right, think of when you make Jello. That's basically protein. You mix it with water. All right, you let it, you boil it to make the water and the proteins kind of bump into each other and stick together better. Then you let it cool off, and you get this gel. That's how well the water and the proteins are stuck together in that Jello. All right. Now, when we say plasma colloid osmotic pressure, we're talking about plasma proteins in the blood that exert a pulling force on water. All right, and the major protein that is involved with this, I'm going to rewind here. The major protein here is going to be albumin. All right, and I apologize for erasing all those notes, but if you need to go back, you can just hit pause and rewind. I'm just running out of room here, so sorry. So albumin exerts about 70 to 80%, 80, pinhead. All right, 80% of the, that plasma protein plays a very critical role in this fluid shifting between blood and tissues. All right, so this plays the largest role in reabsorption or pulling fluids back into the bloodstream. All right, and then there are other proteins like your immunoglobulins and complement proteins and fibrinogen and so on that have a weaker effect. But the biggest reason why albumin is so dominant with this is because albumin is the most abundant plasma protein. All right, plain and simple. So albumin plays a very large role this plays a very large role in reabsorption of fluids back into the bloodstream. Now, tissue colloid osmotic pressure, this is relatively low as well. All right, this is relatively low as well. Now, when we're looking at our colloid osmotic pressures or oncotic pressures, this is typically when you're looking at your Starling forces. This is represented with the pi symbol. All right, and if they're talking about the tissue colloid osmotic pressure, pi I, I for interstitial. All right. If we're talking about plasma colloid osmotic pressure, it's going to be pi P. All right. Pi P. And if we're talking about I forgot the tissue hydrostatic pressure, PI and PC. Capillary hydrostatic pressure, plasma colloid, interstitial, so on. Okay. Now, so basically, the two major processes filtration and reabsorption are basically a sum of all of these forces. Now, these forces are going to change within the capillary beds. Now, if this part confused you at all, I apologize. I know this is a lot to take in. I know this is, but I also understand how critical of a topic this is. I highly recommend if this explanation didn't quite sink in, hit pause, rewind, listen to it again. Just like I said, this is a it's very important that you understand these terms because it'll make the rest of this obviously much more simple. Okay, so now let's talk about the actual forces involved in this. And yes, I did draw this. Try not to be too awed by this wickedly horrific drawing. But so basically what we're looking at here is this would obviously be, remember when you're looking at blood vessels, 99% of the time when you see red, you think arterial. And when you see blue, you think venous, okay? So this would be the arterial end of a capillary bed, and this would be the venous end of a capillary bed, okay? Now, before I get into these forces as well, another thing that I think is important to mention is that, because I didn't really talk much about the tissue colloid osmotic pressure, and I think I think it's good to do this with this image right here, because remember how before I said that capillaries by design are those squamous cells that kind of have this this nature where they don't fully contact each other and there are these spaces in between. Basically, they create these pores where filtration occurs. Now, in these continuous capillaries, these pores are about 5 to 7 nanometers in diameter. So a nanometer, that's incredibly small. Now, that's just a hair smaller than your average protein. Okay? That's just a hair smaller than your average protein. All right, that's much bigger than a water molecule. So basically, water molecules and electrolytes are going to be the smallest substances that are actually going to escape capillaries and get into the tissue spaces. All right, so basically, anything in between the size of a water molecule and that is just smaller than a protein will get filtered out of the capillaries into the tissue spaces. So water, electrolytes, glucose, amino acids, fatty acids, and so on will leave the bloodstream and get into tissues. Like I said, proteins remain within capillaries. Every once in a while, a small protein will sneak out and get into the tissue spaces, but then we have the lymphatic system to grab most of those excessive proteins out of these tissues. And that's why tissue colloid osmotic pressure under normal conditions really isn't a factor. All right. Now that's important because if we load it up, remember before I said that proteins exert a pulling force on water. So if we loaded up our tissue spaces with all these excessive proteins, all right, we would be pulling way too much water out of our bloodstream and filling up our tissues with way too much water, and it would be very difficult to reabsorb them back into the bloodstream. That would tank our blood volume, and that would obviously be bad. That's what happens when someone goes into anaphylactic shock. They have a major systemic inflammatory response. All right, mast cells release histamine. All right, capillaries become more permeable. You dump out all these proteins into the tissue spaces on a systemic level throughout the body, and then that draws too much fluid out of your bloodstream. Your blood pressure drops, and you are now in anaphylactic shock. All right, so that's why we try to keep the protein levels low in the tissue spaces. All right, now the average blood pressure, and again, this is going to vary depending on what book you read, but the average blood pressure in a capillary is going to be about 32 to 37 millimeters of mercury, all right, which is very low. All right, when you think of systolic pressure in the average systolic pressure in your major arteries as being 120 millimeters of mercury, and there's two major reasons for that. One, again, it kind of goes to what speaks about what I just talked about here with the proteins. Remember the hose analogy here. All right, think about this. If we turn the hose up full blast, even more water is going to get blasted out of the capillaries into the tissue spaces, again causing a significant decrease in blood volume and blood pressure. All right, so maintaining a low capillary blood pressure allows us to control this filtration process, And B, remember, capillaries are just a single layer of squamous cells. I mean, pretty much the small, flat cells, there's nothing to them. All right, if blood pressure got too high, that could damage and, that could harden the basement membranes of these capillaries, cause long-term damage, and cause these to rupture, and that could be bad news. All right, so those are the two reasons why capillary pressure is very low. All right. So, so you know that arteries are higher pressure vessels, all right? So as blood is coming in through this meta-arterial and it's dispersing through the arterial end of a capillary bed here, all right, you know that that the pressure is going to be quite high. Let's just say we're at 37 millimeters of mercury here, okay? So let's say so basically if we say, what we're saying here is we're saying the capillary hydrostatic pressure is going to be 37 millimeters mercury. Okay, remember that is a pushing force. That is a pushing force. Now, the average plasma colloid osmotic pressure is going to be around. Is going to be around 25 millimeters of mercury. Okay, so basically what we have here is we have so basically we've got a pushing force of 37 millimeters of mercury and a pulling force of 25. All right, so as blood is flowing into the arterial ends of the capillary beds, all right, if you just do your basic math, and remember we said that tissue hydrostatic pressure and tissue colloid osmotic pressure are going to be pretty much non-factors with this. So let's just keep this simple and just say those are 0 for the sake of discussion. So basically all you would do is take 37 minus 25 and you get positive 12. All right, if tissue hydrostatic pressure was 1, then you would have positive 11. If it was 2, you'd have positive 10. The important thing here to focus on is that we have a positive pressure here. Now, when there's a positive pressure in a vessel, in a blood vessel, especially a vessel like a capillary, that is going to create an outward force. That is going to favor filtration. Okay, and that's why we have filtration in the arterial ends of capillary beds. All right. Now that's important because, like I said, we need to, that's why we need to have this blood pressure at this range, because it's just low enough to where it's not damaging the capillaries, but it's just high enough for us to overcome this relatively constant colloid osmotic pressure in the plasma. All right. Now again, this can change, but under normal healthy conditions, this is about what it's going to be at. Now, as blood flows down the length of the capillary bed, remember, go back to that hose analogy. All right. Go back to that hose analogy. As blood flows through the length of the capillary bed, there's a few things that are happening that are slowing down blood flow and reducing the blood pressure and the hydrostatic pressure here. A, we are just forcing more water out of the bloodstream into the tissue spaces. All right, so that means we are causing a drop in volume in the capillaries. Therefore, that will reduce the water pressure in the capillaries. Less water, less pressure. All right. Another thing is, remember, we are getting further away from the source of the pressure. All right, we're getting further away from the heart. All right, so that will cause a decrease in pressure. All right, and then basically what we'll also have here is, remember before when I was talking about the hose and I said that water rubs up against the walls of the hose and creates friction? That's going to slow down blood flow. All right, that's going to slow down blood flow, and that's going to mean less blood getting out of the tissues, or out of the capillaries into the tissues. So we put all that together. Basically what happens is our capillary hydrostatic pressure is going to drop. All right, so let's say it drops down to 17. All right, our capillary hydrostatic pressure drops down to 17. And remember, now one thing you have to bear in mind is that as more fluids leak out of the bloodstream, our blood's going to become more highly concentrated with proteins. That's just going to make the pulling action of proteins even stronger. All right, so you put all this together. You have a lower volume of water. You have a lower hydrostatic pressure. All right, a lower pressure. There's more friction slowing down blood flow. This is going to favor the proteins a lot more. So now we've got 17. We didn't remember we said that proteins don't, under normal conditions, don't leak out. So all these proteins that entered in the arterial end are still going to be there in the venous end, just more concentrated than normal. All right, so 17 minus 25, that is going to equal negative 8. Hope I did my math right. All right, it's going to equal negative 8. So now, whenever you see a negative number like that, what we have here is that's going to favor a process called reabsorption. Okay, it's going to favor a process called reabsorption. Now, when we see reabsorption happening, this basically what we're going to do is we are going to draw fluid back into the tissue space. I'm sorry, from the tissues into the bloodstream. Now remember, these fluids that were forced out of the arterial end. All right, it's more than just water coming out of here. We are forcing water and oxygen out of here. We are forcing nutrients out of the bloodstream into the tissues. And remember, these cells that are really close to the capillaries are sucking up that oxygen, are sucking up those nutrients, and are burning them as fuels so they can metabolically function and do what they do, be cells, crank out proteins and do other things. All right. Now, these cells are, as quickly as they are taking in these, oxygen and nutrients, they are also eliminating waste products. So, as we are reabsorbing these fluids back into the venous ends of the capillary beds, we are also taking in products like carbon dioxide, organic acids, all right, other forms of metabolic waste. And then those waste products are going to get circulated through the venous blood back towards the, into the liver, back towards the heart, and then pumped to the kidneys, and so on. All right, so let's kind of summarize everything that I just talked about, because I know that was a lot, but let's kind of re-summarize that. So again, remember arterial end, venous end. All right, remember, the plasma colloid osmotic pressure is much higher on the arterial end. So remember, the blood pressure is higher. All right, remember, because on the arterial end, we're closer to the heart, and so on. So as blood enters here, all right, remember, we have, let's just keep our numbers, the same numbers as the last slide, 30, capillary hydrostatic pressure of 37, a colloid osmotic pressure of 25. All right, remember, we do the math here, we get plus 12. That's, remember, positive, that's a pushing force. All right, so we have filtration, and then we deliver oxygen and nutrients. And you probably understand the need for reabsorbing these fluids is more important than just taking in carbon dioxide and wastes into the bloodstream. All right, if we just sat there and pumped water out of our capillaries and didn't reabsorb it back in, that water would just sit there and build up in our tissue spaces, and then we'd have no blood volume after, within minutes. All right, we'd have no blood volume, no blood pressure. All right, so we need to reabsorb those fluids back into the bloodstream so we can maintain a constant blood volume. I'm just going to abbreviate that BV. All right, now one thing I do need to say about this though is that on the venous ends of the capillary beds, we only reabsorb about, and again, this is going to depend on what book you read, but the concept remains the same. About 85 to 90% of what we filter out gets reabsorbed directly back into the bloodstream. The remaining 10 to 15% of fluids that get filtered out, they don't remain in the tissue spaces. The lymphatic system picks them up and then circulates them back into the bloodstream, and I'll talk about that in a little bit. All right, thus completing the fluid cycle. But again, you get the point here. We filter water out on, we have filtration on the arterial ends of capillary beds. All right, and then as blood flows through the length of the capillaries, all right, it's going to lose its steam because of friction rubbing up against the walls. All right, it's basically the blood volume is going to decrease due to the fluids just filtered out in the first place. All right, and that's going to cause a decrease in pressure as well. You put all that together, now we favor reabsorption. All right, those plasma proteins, all right, chiefly albumin, are now going to pull those fluids back into the bloodstream via reabsorption. Like I said, 85 to 90% of what we filter out is reabsorbed directly back into the bloodstream. Okay. Now, in watching this, you should start to kind of pick up on how critical this is when thinking about something like edema, all right, and how this could be a major contributing factor into something like edema. All right, now again, I'm going to cover that in a little bit, but just think about that. Like I said, rewind, listen to this again, because this is a very, very important topic. Also, if you're trying to understand something like inflammation, all right, you have to understand this process before you really truly appreciate inflammation. So make sure this really sinks in. All right. Now we need to talk about that remaining 10 to 15%. Now, typically when we're thinking about these continuous capillary beds throughout the body, I mean, you know, your lymphatic system is pretty much connected to almost every single organ and tissue of the human body. I mean, almost every single tissue of the human body has lymphatics within it. All right. Excuse me. Now, typically these lymphatic capillaries are going to kind of intertwine and embed themselves right next to these continuous capillary beds. All right, so if we have any proteins that sneak out of that sneak out of the bloodstream, all right, these lymphatic capillaries will pick them up. All right, we'll pick them up and recirculate them back into the bloodstream. All right. Any excess fluid that comes out of here is going to be rapidly absorbed right into these lymphatic capillaries. All right. Now, one thing to bear in mind about these lymphatic capillaries, though, whatever goes into them stays within them and stays within the lymphatic system until it eventually gets reintroduced into the bloodstream, because lymphatic capillaries have one-way. The way the cells are designed, they're basically one-way channels. All right. So whatever comes in stays in. Okay, so basically these lymphatic capillaries are very, and again, the concept is the same with cells. It's important for these lymphatic capillaries to be very close to these capillary beds so we can rapidly pick up that excessive 10 to 15% of filtrate or tissue fluid that did not get reabsorbed back into the bloodstream, all right, to keep the fluid levels normal. Because if we let that fluid accumulate, remember the distance between cells here, all right, as that fluid accumulates and we create edema in the tissues, cells get pushed further away from capillaries, and you can do the math on how bad of an idea that is. All right. So lymphatic capillaries pick up that remaining fluid, and then eventually what they do is they circulate it. They circulate that fluid throughout the lymphatic system. Now, basically, this fluid is going to flow through a system of lymphatic vessels. Now, there's no direct source of pressure. What I mean by that is there's no pump like the heart for blood vessels to drive the flow of what's called lymph through the lymphatic system. So those fluids that are absorbed into the lymphatic system, are once that tissue fluid is absorbed into the lymphatic system, we now call it lymph. It's a clear, colorless fluid that's very similar to plasma. All right, it's almost identical in it's basically in water, electrolyte, protein content. All right, with some differences, but you get the picture here. Now, so basically, the major driving force that allows lymph to flow throughout the lymphatic system, a big part of it is interstitial fluid itself. All right, the more the water or fluids that accumulate in the tissue spaces, the greater the flow of lymph. All right, and other factors that play into this are, for example, muscles. As muscles contract and squeeze these lymphatic vessels, it'll squeeze lymph throughout here. So if you exercise, you're gonna circulate more lymph. Massage, creates lymph flow. I mean, there are actual techniques in massage called manual lymphatic drainage, all right, for certain cases of edema with patients to try to relieve, the swelling and pressure. All right, the pulsating actions of arteries, because remember, lymphatic vessels run parallel to arteries, so as arteries pulsate, this could create flow as well. And these lymphatic vessels also have these intrinsic mechanisms built in as well, to where once they fill with enough lymph, they're going to in the walls stretch to a certain capacity. Then basically the smooth muscle that lines the walls of these lymphatic vessels are going to contract, and that's going to squeeze lymph from one area to the next. All right, which you see here in this picture if you follow the color pattern of the yellow here. So basically, lymphatic vessels, if you look at how they're designed, they're very similar to medium-sized veins. Remember, medium-sized veins have valves, all right, within them to promote one-way flow. Now, on average, we circulate about 100 milliliters of lymph per hour. So we circulate a little over 2 liters of lymph per day. 2.4 liters, obviously, if 24 hours in a day. Now, if you look at this picture here, eventually what happens are these lymphatic vessels start to collect and form these collecting ducts, and then eventually, and I'll get into that later in another video, but basically what I want you to remember for this is that basically all this lymph is eventually going to recirculate itself back into the subclavian veins. All right, these collecting ducts meet and drain into the subclavian veins. Remember, subclavian, below the clavicle. Okay. So when you couple the reabsorption process of the venous end of capillary beds and the flow of lymph throughout the lymphatic system back into the bloodstream, that is the fluid cycle. And under normal conditions, everything is just fine. All right, but there are certain situations where these forces are thrown off and we can form edema. All right, this is a big complication that's associated with this. So basically, there are two major forms of edema that you see in patients on average, and this is what's called pitting edema. Pitting edema occurs when you have an accumulation of water in the tissues, and there's another form called non-pitting, or what's oftentimes referred to as mixed edema. And that is an accumulation of connective tissue, all right, which is typically associated with endocrine disorders like thyroid disorders, all right. Now, when you accumulate water in excessive amounts of water in the tissue spaces, what happens is, the tissue gets really soft. So if you take your thumb and press it into the area that's really swollen, then what's going to happen, and you hold it there for 15 seconds, and you remove your thumb, well, what's going to happen is you're going to see a pit. You're going to leave an indentation in that person's skin, all right? And then basically that's a pit. And what happens there, basically what you did there is you increased the tissue hydrostatic pressure and you created a little bit more reabsorption and you forced some fluids back into the bloodstream. It's the same concept as wearing a watch too tight or wearing a ring, like a wedding ring on for too long. When you put that on, you increase your tissue hydrostatic pressure and you make it harder for, that capillary hydrostatic pressure, you make it harder for filtration to occur, and that's why you have that indentation in your skin. All right, but eventually what's going to happen once you remove your thumb is this pit will eventually come back. I mean, if that watch indentation will go away. All right. Now, when you look at this person's skin here, this is where you have to come back and think about what I said before about the distance of cells and capillaries. All right. So basically, the skin, obviously, you can see the dry skin here. I mean, you can see, the redness. I mean, this is not a good scenario here. So what's going on here is that with all of this water accumulating in the tissue spaces, it's pushing cells further away from capillaries. And as cells get pushed further away, I've already said this a couple of times, it's harder for them to get oxygen. It's harder for them to get rid of waste products. So over time, basically these cells are going to start to die, and because of the lack of oxygen and the waste accumulating in here, that's going to basically metabolically slow down the turnover rate of these cells in these tissue areas. And that's why the skin gets really dry. And so on. I mean, think about this. Think about someone that you've seen who's had really bad ankle edema. And think of like the dry skin that you've seen around that ankle area. That's what's causing that, all right? The lack of the hindered ability to properly oxygenate the cells in that area, okay? And then with non-pitting edema, when you have an accumulation of connective tissue, if you were to do that same test, if you took your thumb and pushed it into that tissue, and let go, that there won't be a pit. That skin's going to immediately recoil or pop back up, because that's not water. That's a gelatinous tissue, connective tissue building up in that area. And like I said, that's typically associated with endocrine disorders. All right, so let's look at some factors that promote edema. All right, so an increase in capillary hydrostatic pressure. All right, increase in capillary hydrostatic pressure. I mean, this is easy. I mean, this is basically hypertension. Okay, if you're cranking up the pressure in the vessels, you're gonna make it easier. You're basically going to increase that capillary hydrostatic pressure with high blood pressure, and you're going to favor filtration more. All right. I mean, it's that simple. I mean, it's the same deal here with the hose. You know, if you turn the hose on, all right, you turn the hose on, and you remember before when I was giving this analogy, I said we only have it on half blast. Well, now let's say we turn up to 100% power. Now you're going to have a lot more water flowing through here at a higher rate with more pressure. All right. So basically, as water, so more water is going to get filtered out. And by the time you get that water dribbling out of the hose, that's gonna happen much further down the hose because of the velocity and force and pressure that the water is flowing with. All right. So basically, an increase in capillary hydrostatic pressure, and like I said, a good example of that is hypertension. A decrease in the protein concentration of your blood, or plasma colloid osmotic pressure. All right. There are two situations that pop into my head. One of them would be starvation. And the other one would be liver damage. Okay, so starvation. Obviously, in order to make protein, you need to consume it, right? You need to consume amino acids so we can make them. And there's a particular condition called kwashiorkor, and if I'm saying that wrong, please somebody correct me, because I had a student many years ago, wonderful gal from Nigeria, but I think she just liked to laugh at me. But would always laugh at me every time I would say that word, because obviously, with her accent and dialect, I tried to say it like she would, and I just couldn't, and she laughed at me. But that was fine. But again, that's a condition that you see a lot in children who are very starved. I mean, you've probably seen pictures of this. I didn't really want to look up a picture of this, but basically, you see these children with these big abdomens, all right, and these really skinny limbs. Harden my heart, people. All right, but basically, what's going on here is that in the abdomen, this is all water. All right, this is all water. And then their limbs are really skinny because obviously if you're not consuming calories, well, you're gonna cannibalize your muscle tissue, so you can utilize amino acids and calories there for metabolic purposes. So basically, so if they're not consuming enough protein and other calories in their diet, they're not going to make enough albumin, and that's going to lower their plasma colloid osmotic pressure. That's going to lower their ability to reabsorb fluids back into the bloodstream, and in this situation, this fluid typically accumulates in the abdominal areas. All right, and obviously, now think about this. You're not doing the person really any good. I mean, on a short-term basis, you give them a little bit of relief, but you're not really doing the person any good if you just stick a needle in there and pull all the fluid out, because you're not fixing the actual problem. You're just giving temporary relief. So in situations when you have edema like this, you have to fix the primary problem, all right? Because like I said, because if you don't fix these forces, it's just, this is just going to continue. So obviously, to fix this problem, you have to get them. This is typically a very reversible condition, but they have to, increase their caloric intake of proteins, fats, carbohydrates all around. All right, especially proteins. All right, now with liver damage, the liver is where we make albumin. All right, so obviously the first and easiest example that should pop in your head would be something like chronic alcoholism, cirrhosis of the liver, hepatitis C, and so on. But basically, now think of a chronic alcoholic. I mean, when I say, I'm not talking like a weekend warrior, I'm talking someone who can't function without alcohol. All right, they have a very distinct look to them. They're typically a little skinnier on average. More distended abdomens like so, and skinnier arms for the same purposes. Because think about it. I mean, the alcoholics really have responsible diets? Yeah, not really. So the lack of, again, calorie consumption, and then all the damage the liver is taking on from getting pounded by the alcohol, that's going to cause water to accumulate in their abdominal spaces. So obviously, what do you do here? You have to fix the condition. All right, the alcoholism in the liver. An increase in capillary permeability. Inflammation. I'm just going to abbreviate this. Inflammation. All right, with inflammation, you have what you have going on here is basically you release chemicals like histamine that basically make those endothelial cells and capillaries kind of retract or pull away from one another, and basically increase that space in between the cells. And what happens is when this happens is we drive proteins out of the bloodstream, out of the capillaries, and these proteins accumulate in the tissue spaces, thus increasing, thus increasing the colloid osmotic pressure of the interstitial fluid spaces. All right, and then this will draw more fluids from the bloodstream into the tissues. And again, you know how that this is important because we need to get these proteins like complement proteins, antibodies, and other chemical mediators of inflammation into these tissue spaces where there's tissue damage or infections. All right, and but this is a big reason why that you see the swelling with edema. All right, by increasing the colloid osmotic pressure of the tissues. And now, like I said, picture this happening on a systemic level. This is why people are going to get, anaphylactic shock. All right, but so like I said, keep this in mind because the next video I want to make is on inflammation. So keep this one really in the back of your mind. And then an increase in tissue hydrostatic pressure. So basically, this could happen, if you have a thrombosis in a vein. So if you have if you have an obstructed vein, all right, and then that creates a backup or backflow of blood into the capillaries, that's going to make it harder to reabsorb fluids. If you have more fluid in the capillaries, it's going to increase the water pressure, make it harder to reabsorb. All right, or with right heart failure, all right, congestive heart failure, right heart failure. How many times can I say right heart failure in 5 seconds? But again, that's going to the same effects there. All right, is if you obstruct this vein and fluids are backing up into the capillaries, again, you're gonna favor filtration way more than reabsorption. Or another example of this, elephantiasis, is an obstructed lymphatic vessel. All right, this is not elephantitis. Elephantitis means inflamed elephant. All right, that's obviously a slightly different thing. So this basically is a condition also called filariasis. It's very common in what's called malaria hot zones or tropical areas of the world around the equator. But basically, this is a condition that's caused by mosquitoes. These mosquitoes bite, and then it's the female mosquitoes that bite. Actually, by the way, so thank you, females. But the mosquitoes bite you, and then they insert eggs. They carry these these eggs in their mouths, and then these eggs get into the bloodstream, or they get into the tissue spaces. They get rapidly absorbed by lymphatic capillaries. And then eventually these eggs hatch into these parasitic worms. And these worms just hang out in the lymphatic vessels. And that's a great place to be because if these worms are in the lymphatic vessels, there's no antibodies around. All right, they're not actually in a lymph node, so they're away from all the white blood cells, and they have a lot of proteins flowing by them. So I mean, that's a pretty good place to be if you're a parasite, if you can embed yourself in a lymphatic vessel like that. But you get the picture here. As these lymphatic vessels get full of these worms, they become obstructed. And then that obviously obstructs the flow of lymph. And that's only going to do one thing. That's going to cause a back pressure and a back flow of lymph. And that normal 10 to 15% of fluids that are being reabsorbed in these particular areas are now not being absorbed into the lymphatic system and getting back into the bloodstream. And they are accumulated in the tissue spaces, thus causing, very, very severe disfiguring discomfort, uncomfortable anemia, or anemia, bonehead, edema, all right, edema, not anemia, sorry. Okay. All right, so that is basically my presentation on capillary fluid dynamics. Like I said, this was obviously a pretty dense topic. I recommend watching this, reading your material, watching it twice. Don't hesitate to stop and rewind because this is a very foundational, critical topic for you folks to understand. And if you have any questions, don't hesitate to contact me. I'll do my best to get back to you. And take care.